Кочаловская или Копыловская, Валентина? Я не прочитала. Пожалуйста. Пользуйтесь на здоровье. Ну что, последняя. Своя рука владыка. Кого? Последнюю корзину разыгрываю подарочную. Все. Момент истины. Зосим. Просто фамилия. Ну, это не мне спасибо, а судьбе. Александр Васильевич, я вам все большое. Ты живая?
Смотрите, всегда возникает вопрос. Вот я поворачиваю голову, да, с противоположной стороны становлюсь, поднимаю бровь. Вот что здесь, да? По идее, если проскакивать лицевого нерва, и я должен попасть. На самом деле, она идет между двух глаз и височком. Когда я поднимаю бровь, она у меня оказывается над пальцем. А под пальцем там только подкожные вены нужно носить. И когда вы на расстоянии иглы вкалываетесь и сразу попадаете на кость, главное спасение не пробуйте туда-сюда и двигать, только уперлись и сразу уходите в зависимости от движения бровей.
Ну, нас сказали выводить уже. Выводить.
Okay. Hello again. Okay, I'm online. Hello. I've been waiting very to be here again. So let me show you the patient. This patient is here for thread lifting technique. So we're going to use a monofilament threads with addition of RRS AJ tensor lift. So we have a patient that has a bit of skin flaccidity here, and she's really a good patient because she doesn't have a lot of subcutaneous fat, because if we would do that, we would probably need to do the treatment that you saw with Evgenia Raneva. But she is very nice to do and have an immediate result. So, I need a pen. You know, a lot of people are doing threads and they have different techniques. I use a very simple technique called the mesh technique. So you, what you do, you just put those lines. Actually, first thing is you want to lift up, and this is, let's say, the way that you want the lift. Since we are not using cob threads or barbed threads, we are not going to put those in here to get this result. But the threads that we are putting to get these lifting effects are actually those horizontal threads. I'm going to put 10 threads in here. The distance between those should not be over 1 centimeter, because otherwise you're not going to have an effect. And less than 2 or 3 millimeters is too much. So I'm going to put 10 horizontal, 1, 2, 1, 2, 3, 4. Another pen, please. But to get the best effect, we're going to use those perpendicular lines to this. We're going to have it like this. So we are going to line up those lines like this. You're also going to need about 10. So we need about 2 more. Okay, this is how the mesh should look. First I'm going to start with the longer one. Do we have 90? No, 90. Okay. David. Good. Okay. Before the treatment, there was just a local anesthetic cream on top, because otherwise this treatment is a painful one, depending on the patient. That is what usually is just enough, but for some patients not. So for the other that are more sensitive, I would use nerve blocks with injectable lidocaine or articaine. So you read. This one is used. That. Most people don't want to work, okay? When you take it out, put it like this, and I'll just take it out from here. Okay, so the first line, you always check the distance where you can put the needle in. Of course, since it passes through a lot of length, you can always harm some blood vessels. So you could always have a hematoma during, usually after the treatment. The place where you need to put them is subcutaneous tissue. It could be derm, but you know, derm is very hard to really be into it. But derm or subcutaneous tissue is just fine. But if you go too deep, you're not going to get an effect. And please be sure not to be too shallow on the surface, because otherwise the thread could be visible through the skin, and that is not something that you want, because the thread itself has some bluish color, and you know, it can be easily seen on the sun or daylight. Also, when you do it, it's really nice that you have an assistant who is going to take over and take out this plastic out from the needle, because if you have to do everything, you will lose a lot of time. And be careful with taking out the needle, because sometimes if you're not careful and doing it really upfront, you're going to take out this sponge, and then you will have the thread just flying over, and you're not going to do good treatment with that. And of course, when you're doing it with the good threads like these are, you will have a really easy job because it glides really easily. Because in my experience, I had some not as sharp threads as these are, and I had really the problem to puncture the skin. So sometimes they would go like this and all over, and I would have like losing a minute or two just trying to pinch through the skin, because sometimes you also have a thicker skin. And excellent. This patient is really excellent. Another thing that you also have to bear in mind is, don't you ever puncture through the other side of the skin. So that needs to be, something that you're not going to do. So only one injection point. So as you see here, we're doing the threads, and fortunately for now, we don't have any. Can we have a little more of this here? Okay. When you have drawn the lines, so just to be sure that you have the disinfected well, you just put it a lot of hot hexidine on it and just tap like this. So no sliding motion, because that will wipe out your lines. One more thing not to do is, when you draw those lines, never insert a needle through the line, through this marker, because you will have potentially tattoo into the skin, and with that you can also bring in biofilm. So eventually you can have a granuloma, and not because of the thread itself, but because of the not really good technique. So be careful. On the other side, since you are having sterile threads into this, and they're all taken into a separate sterile, let's say, cannulas, you don't really need a sterile operating room, but you can do it in an ambulance or an office like this. So you see here that we already put in 10, I think 10, and the good thing is those are having a holder, so it helps you put the thread inside. But since we are going to inject RRS tensor lift inside, I'm going to take those off. It's a bit hard work, but somebody has to do it. It's either you or your assistant, and it all depends on the producer or the brand you're using. And it's really a clever thing, because it helps you put the needles easier, and when you need to apply mesotherapy cocktail, it's really easy for you. And as you see, using a lower lock syringe will help you to not spill your product when you put it on the needle. And you see, these needles are made for that. They're not just made for holding. You saw the holder, and I took it out. What I need is now just a needle. And if you do this, taking out the needle without the product, you will have the result. But you're doing an empty, let's say, work. So work that doesn't lead to anything. Because now you combine two treatments without any problem. So you see, you need only a little product inside, usually 0.1 or 0.2, and that's it. If you use a 1 milliliter syringe, it's going to be much easier for you because you will control easier the amount of the product inside. And I never do those vertical threads before I take out those horizontal, because when you put those vertical in those horizontal, if you haven't taken them out, are going to be in place, and you're going to have this location of the thread or of the needle, so you're not going to be into the right plane of the skin. With this method, as you saw it on the presentation, you have the best of both worlds. So you don't do more injections. Maybe you haven't seen, but my assistant here, first thing that she asked me when preparing this product is whether I like the needle 30G or 33G. So no, I don't need another needle. The needle I need is already in the skin. So this is how you do it. This is just making it easier, making it more simple, because simple things are reproducible, and those simple things often give the results much better than the more complicated, because with the complicated things we get sometimes, we don't know what else to do. But as you saw in the presentation I had this morning, these two things, they both have they both are effective and have the results, so why not combine them? Because the combination of them is really something that will benefit from both. So collagen induction from the polydioxanone thread is something that it is well known, and we now know that RRS high injectable is also something that produces and decreases the production of collagen. And when we combine those two, because this product is also filled with so many amino acids, and without amino acids there are no collagen or elastin, so because you don't have material from what they are made. And also all those vitamins and the minerals are part of the biochemical reactions in our body. So combining these two, you will have the best result for the patient in a minimal time. If you had luck and some of the skill, the patient after your treatment is going to look pretty nice, and she can go to work or doing anything tomorrow without any problem. I would need 6 now. Now what I'm going to do is finishing this mesh, and this mesh is now finished with those the threads that are going upside, almost vertically. They are not those that will lift the face, but since they're going like this, they will fix the face like this, so we will have the tensing effect on both sides, and that is actually what we really need. We need to tense this skin that becomes flaccid. And as you see now, I'm removing the holder because working with those threads that are 60 millimeters in length or 6 centimeters is very easy. So you can be really sure that the length of this, let's say, cap is very much just enough for you to grab and hold, because with that you're going to be just fine after without moving your patient a lot. Because if you just move your thread, your needle inside, you're doing too much inside the skin, and actually hurting the skin more than you should. And that can also cause more inflammation, more edema, and we also want, you know, the patient to look as best as it can only after the treatment. So you know, if a patient looks like went through the war or a fire, that's something, you know, that is really not good. But you know, people forget things, but it's hard for them while through their downtime. And also, if you are into a right plane, the needle will just go through. So if you're going, if you're having trouble and you see or feel that something is blocking your way, you're probably too superficial into dermis, and that is, you know, the most superficial that you can. But as if you see a needle through the skin, then you're too superficial, meaning you're probably into epidermis, and there is somewhere you don't want to go, because you will not have the right effect, and the only thing you're going to have is the color of the thread just seeing through the skin, and that's something you don't want to. I mean, you know, it will fade away because the thread is resorbable one, but it takes 4 to 6 months to complete hydrolysis of the thread. Until then, it could be an unsightly vision. As you see, I know that a lot of people are doing a combination, but as far as I understood, is they do a thread and then they do, let's say, a microdermal papilla after that. I mean, that is something that can be done, but we are speaking here about a minimally invasive procedure, and a minimally invasive is using the same needle, the same puncture point that you already made, and that is something that you should think of. Okay. And to tell you the truth, I always perform this when I do linear threads. I always combine it with RRS. If a patient is not willing to pay an additional charge for a tensor lift, I would then go with Silisor tensor, which is much cheaper substitute, but it's still a product that also doing the same result, tensing the skin. And if they are looking for paying additional charge, I would then use tensor lift because tensor lift is much more expensive than a silicoic. Okay, this is it. And hopefully after we do this and we ask a patient that she sits up I know. Okay, so I finished one part. The other one, yeah, I'm going to finish hiding. So what I want to show you is, we should see a difference between this part and the other part. Okay. Okay. Definitely, if you can zoom on her face. Can you just take this anesthetic off here, please? Okay, here where we done this combination treatment, we see that her jawline is not visible as before, and although she didn't have a huge jawline, but she does, but on this side it's much less visible, and also the nasolabial fold. So you can see for the first impression that it does have an effect, but you should tell the patient that the real effects are going to be in month and a half, up to 2 months, depending on the age of the patient. But the biggest effect are going to be on the 4 to 6 months after the treatment. I'm going to finish this patient after, and I should probably go to before you and answer the questions, if that is okay. Okay? Just wait, please.
Заключение.